Say good afternoon. It's exactly noon to Chair Carr and members of Council. Thank you for the opportunity to provide yet another public health update on COVID-19. Today I'll be sharing an update on our local public health surveillance data, including the variants of concern, the provincial framework and responsibilities of businesses, and the status of COVID-19 vaccine rollout here in Halton. Next slide, please. So this slide shows the weekly incidence rate of COVID-19 since the start of the pandemic for Halton, shown in green, and our neighbouring health units, shown in shades of grey. The weekly incidence rate is the number of new cases in that week for every 100,000 people living in the health unit. You can see that Halton has consistently had a lower incidence rate compared to Peel, Toronto, and York, while faring generally more similarly to Hamilton and Wellington, Dufferin, Guelph. While this can be viewed as a success and a testament to the adherence of our community to public health measures over the past year, there are other important factors that likely underlie our lower incidence rate, including higher socioeconomic status, which can be associated with less involvement in essential work and increased ability to work from home, fewer industrial businesses in our region, and lower population density. Despite having a lower incidence rate than surrounding areas, Halton's rate remains above the threshold of 25 per 100,000, shown by the red line, that has been recommended by the Science Advisory Table for implementing stringent public health measures. Moreover, there will always be risk present when incidence rates remain high anywhere in the GTHA, given the close proximity of these health units and interactions between residents. Next slide, please. As of March 22nd, Halton has seen over 10,000 cases of COVID-19. This includes 320 cases that are active right now and sadly 200 deaths. This graph shows the number of new cases per day broken down by whether they are known to be variant cases in green or non-variant cases in gray. For the purposes of my presentation today, variant cases are defined as those that have been found to have a mutation associated with a variant of concern, which are strains of COVID-19 that are more contagious, cause more severe illness, and or may be less susceptible to protection from currently available vaccines. This includes 26 confirmed variant cases and 357 cases who have screened positive for the mutation, but haven't been sequenced to identify the specific variant. As we know, the vast majority of individuals who screen positive for the mutation do in fact have the variant. The 7-day rolling average for non-variant cases, shown in gray, has mostly trended downwards since peaking in early January. However, the 7-day rolling average for variant cases, shown in green, has been steadily trending upwards throughout 2021. Please note the orange line, which indicates the most recent 7 days of data, when variant cases are likely to be underestimated because the results of mutation testing are usually not received until several days or more after the case's initial COVID-19 positive test result. It is possible that the uptick you see in the gray line and the downturn in the green line for the most recent days is simply because some of the new cases from the most recent days have not yet been identified as possible variant cases. The steady decrease in non-variant cases, accompanied by a steady increase in variant cases, has led to a situation being described as two pandemics. This includes the traditional non-variant COVID pandemic, which was coming under control, and the new pandemic of variant COVID-19, which is putting the province into a third wave, confirmed last Thursday by Dr. David Williams. Next slide, please. So this slide further demonstrates how the percentage of new cases reported among Halton residents per week that are variant cases has been trending upwards over time. In early January, almost no new cases reported in a week were confirmed or likely variant cases. By the week beginning March the 14th, this figure has risen to 36%. Other indicators of growth, such as doubling time since January 1st and the effective reproduction number, support the assessment of a parallel variant pandemic that has become a third wave. It is now taking only about 1.7 weeks for the count of new variant cases reported since January 1st to double, compared to 12.6 weeks for non-variant cases. The reproduction number for variant cases in Halton is 1.1, meaning that each variant case is infecting on average 1.1 other people compared to 0.8 for non-variant cases. This is especially troubling when you consider that reproduction number should ideally be much lower than 1 for variant cases, given that they are known to be more contagious. Next slide, please. So all of the 26 confirmed variant cases reported among Halton residents so far have been the UK variant, with an additional 357 who have screened positive for what we call the N501Y mutation, but do not have a specific variant identified yet. The N501Y mutation is generally associated with the UK, South African, or Brazilian variants. Unfortunately, just 9% of our 383 total Halton variant cases either traveled themselves or were known to have had close contact with a traveler. This means that the vast majority of our cases likely acquired their variant strain infection from community transmission right here in Ontario. Next slide, please. So the findings I've shown you so far truly demonstrate that there is a race between the rise of variants and vaccination efforts in Halton, as in the rest of Ontario. Thankfully, with vaccination in long-term care and retirement homes almost completed and vaccination of residents aged 75 plus in the community underway, we have begun to see the benefits of vaccination, especially for those residents aged 80 plus in Halton, who we know have been the most at risk for mortality throughout the pandemic. The slide shows the number of new cases per week among Halton residents aged 80 and over since mid-September. You can see that overall the number of cases in this age group has declined notably over the last few months, from 64 cases in the week beginning January 3rd to just 4 cases last week. The green portion of the bars show that most of the cases among residents aged 80 and over have typically been attributed to individuals living in institutions such as long-term care and retirement homes. Recently, the few remaining cases among people aged 80 and over that have occurred have been mostly in non-institutional residents. We hope to see such cases mostly eliminated in the coming weeks as we continue to vaccinate our residents aged 80 and over in the community. The orange line further demonstrates that the percentage of Halton residents aged 80 and over with a positive result when tested for COVID-19 has also declined in recent weeks. Next slide, please. So consistent with this observation, we have seen the number of institutional outbreaks active on a given day, shown in green in this graph, decrease. The number of Halton institutions, which includes long-term care homes, retirement homes, and hospitals, experiencing an outbreak on any given day was routinely in the double digits throughout the fall and winter. But on March the 22nd, we had only 2 active outbreaks in institutions. However, we are continuing to declare many new outbreaks in workplaces and schools particularly, with some involving variant cases. Next slide, please. Throughout the fall and winter, we experienced a tragic and rapid rise in the number of deaths among our COVID-19 cases due to the second wave. We have finally seen the rate of increase in new deaths slow down considerably in recent weeks, with just a 4% increase in new deaths over the past 30 days, which is much lower than the double-digit increases we saw in the preceding 30-day period. Again, this is likely thanks to the protection afforded to residents aged 80 and over through our vaccination efforts since January. However, we know that deaths do occur in residents of other age groups as well, and that the UK variant increasingly present in our community is associated with higher risk of severe illness and death, which threatens the improvements we have seen in the death data recently. Next slide, please. The slide shows the number of patients with COVID-19 in Halton hospitals broken down by hospital site. As I've shown in a prior presentation, residents aged 80 plus from long-term care and retirement homes, despite accounting for the majority of deaths in our region, tend not to account for many of the COVID-19 patients who require hospitalization. This means that while vaccination has been associated with recent improvements in mortality, it may not yet be leading to an improvement in hospitalizations. Indeed, this graph shows that while the number of confirmed COVID-19 cases occupying a bed in a Halton hospital declined through the month of February, the number has again begun to increase. On the most recent day for which data are available, which is March the 22nd, there were 31 inpatients in Halton hospitals with confirmed COVID-19. Among the 31 cases currently in hospital, 10 are in the ICU. On March the 15th, the Ontario Hospital Association issued a statement indicating that they were already seeing the effect of the third wave, with the number of patients in intensive care across the province rising due to many variant cases. At the time, a snapshot of inpatient demographic data was provided to us by our local hospitals on March the 22nd for Halton Healthcare and March the 18th for Joseph Brant. 29% of COVID-19 patients were Halton residents, meaning their primary residence is a Halton address, while 71% lived outside Halton. 59% were 60 or older, but none were known to reside in a long-term care home. Next slide, please. The COVID-19 provincial response framework was strengthened when the province returned to the framework in February. Halton region remains in the red control level of the framework. I would like to highlight some key parts of the framework that may be less well known to our community. All businesses must limit capacity so that every member of the public is able to maintain 2 meters of physical distance from every other person. All businesses are also required to have a COVID-19 safety plan to help workers understand how they plan to manage the risks of COVID-19. Workplaces must actively screen all workers and visitors entering the work environment on a daily basis. Before entering any place of business, patrons must be either passively or actively screened, depending on the type of business. Any staff, essential visitors, or patrons that do not pass screening should immediately go home to self-isolate. We are grateful for the efforts and sacrifices made by the business community throughout the pandemic to help keep employees and Halton residents safe and healthy. To keep local businesses informed, we have created sector-specific fact sheets and maintain our website with the most up-to-date regulatory information and guidance for businesses. For any specific questions about COVID-19 provincial regulations, businesses are encouraged to contact the province's Stop the Spread business information line. Next slide, please. On March the 19th, the provincial government announced changes to dining capacity limits that would be taking effect at 12:01 a.m. the next day, March the 20th. For regions in the orange restrict and red control levels, capacity limits for indoor dining are being adjusted based on a standard scalable calculation that will allow for up to approximately 50% of the indoor dining area to be accessible to the public, subject to the physical distancing rules. The total occupancy cannot exceed 50 patrons in the red control and 100 patrons in the orange restrict level. Indoor dining is limited to members of the same household, with exemptions for patrons who live alone and are caregivers. We recently responded to an outbreak at a local Oakville restaurant, now totaling 7 staff member cases infected with COVID-19. All 7 confirmed cases are of a variant of concern. Because we were unable to obtain a complete list of patrons, a media release was issued to notify patrons of their exposure risk. This was necessary to protect both the patrons and also other members of our community. As of yesterday, 4 patrons have also been confirmed as cases, and I suspect we will see more cases as our investigation continues. A total of 261 high-risk contacts have been identified. So to help protect our community from community transmission of COVID-19 in restaurants and other food and drink establishments, I issued additional instructions which took effect on March the 23rd under the Reopening Ontario Act, or ROA. The instructions provide clear direction for physical distancing requirements, active screening of patrons and employees, and the collection, recording, and retention of patron information for contact tracing purposes. Next slide, please. Halton Region Public Health continues to work with our enforcement partners and local businesses to help ensure businesses are following COVID-19 regulations and are maintaining all safety requirements. Public health inspectors regularly inspect certain businesses, such as personal service settings, pools, and food and beverage facilities. In addition, they provide education and consultation to businesses and respond to COVID-19 complaints made by the public. Between January 3rd and March 22nd, 2021, a total of 329 complaints have been responded to by our public health inspectors. This includes 137 complaints related to the use of masks, 80 related to social distancing, and 112 related to capacity limits, screening requirements, or reopening queries. Halton residents can report non-compliance with public health recommendations involving food premises and or personal service settings by calling the COVID-19 enforcement hotline. Please note that complaints and offences under the Reopening Ontario Act that were issued or received by the Halton Regional Police Service or municipal bylaw officers are not included in the data on this slide.